My name is Dr. Brian Smith. I'm Chief of Surgery and a General Surgeon here at Physicians Regional. I specialize in robotic hernia repair surgery and also laparoscopic gallbladder and anti-reflux surgery. In general, reflux is heartburn and sometimes regurgitation with burning sensation in the upper abdomen that goes up into the chest. Some patients also get shortness of breath and a cough with this, a chronic cough, and sometimes are misdiagnosed as having asthma. For a lot of people, this can be controlled with medication, but some people will still, unfortunately, have continued reflux. Also, this can be caused by a hiatal hernia, which is basically a defect in the diaphragm around where the esophagus comes down. If this happens, the stomach itself protrudes up into the chest, and it basically can't really be controlled with the anti-reflux meds, and at that point does almost always need a surgery. Over time, the hiatal hernias will get larger and become more symptomatic. The procedure is a laparoscopic or robotic procedure where the stomach is wrapped around itself, and this helps to buttress and strengthen your body's natural anti-reflux mechanism, which is called the GE junction. For people who have a hiatal hernia where the stomach is up in the chest, we also have to pull it out of the chest and then close that defect with some sutures and sometimes also some mesh. That surgery usually takes about an hour to two, sometimes up to 3 on really large hiatal hernias. And for these patients, then they're kept in the hospital overnight, mostly just so that they can be watched a little bit and get some anti-nausea medications through the IV if they need it that first night. For the first few days to a couple of weeks, you basically have to be on a pureed diet because there's some swelling from the surgery, and it can make it difficult to eat real solid or thick foods. Slowly, though, we get you back to a normal diet, and then over time should be able to wean off the anti-reflux medications. Some patients do need to continue some, but would hopefully be able to just use over-the-counter meds as needed for reflux, especially if they know they're going to eat or drink some trigger foods like chocolate or wine, other alcohol. Most people do well with this procedure, and it definitely improves their quality of life. Usually the timeline for returning to exercise and things like golf or tennis would be about 2 weeks, especially for the hiatal hernias. It's important in those first couple of weeks to allow that area to heal without a lot of stress on it, which could tear the repair and cause it to recur early.